Hi, this is Andrea Kane, and I am here for HSC 114 Medical Terminology. This is for week 4. We're going to start with chapter 7, and then the video after this will be for chapter 8, and the video after that will be for chapter 9. This will be a very long one, so be sure to make sure that you note your time if you have to hop off early, because this is going to be a long video. There's over 100 slides to go through on this one. So let's dive in and talk about the urinary system, shall we? Here are our goals. They are the same as what you can see at the beginning of your content this week in the message there. And if you look at your syllabus, we are now up to Unit 3. So if you're looking at your syllabus, we're talking about Unit 3 and those competencies. If we're talking about your textbook, it will be Chapter 7. We're going to do all of these goals as we move through here. And it's pretty much what we do for every chapter. So let's talk about it. Nitrogenous waste. There's urea, creatinine, and uric acid. What are the functions of the kidney? They filter those wastes and form urine. They filter the blood to pull out those wastes. They maintain the proper balance of water and electrolytes and acids in your system. You may hear of somebody who's got an electrolyte imbalance. Something then is probably going wrong with their kidneys or impacting their kidneys and keeping them from doing that. The kidneys also release hormones. Did you know that? There are some enzymes and hormones that are important, and you can see what those are about blood pressure, red blood cell production, and good old vitamin D, absorbing calcium from the intestine. And of course, we know calcium helps with bones, and when we get to the musculoskeletal chapter, we'll talk more about that. It also degrades and eliminates hormones from the bloodstream. So let's say you've got too much or they are fading, it'll pull them out of the bloodstream and get rid of those. The organs of the male urinary system are kidney, ureter, urinary bladder, and urethra. And this is a picture of those. This is a good one to look at. You can see the veins that are coming through, the veins and arteries that are involved with this. You can see the kidneys, the adrenal glands that sit on top of the kidneys, and it goes all the way through here. You can see where the prostate gland is just below the urinary bladder. Now note the difference between ureters and urethra. You're going to need to know the spelling difference for those as you go through this course. So make sure you don't get those confused as to where they are and what they do and their spelling. It also shows you the different parts of a kidney. What are the organs of the female urinary system? Kidney, ureter, urinary bladder, urethra. You'll notice they're the same. And here's a visual of that as well. The difference is between where you have the prostate versus the uterus and the vagina and those types of things. But you can see that the kidneys still sit where they sit. They still have adrenal glands on top of them. They still have ureters connecting the kidneys to the bladder, the urinary bladder, and then a urethra leading from the bladder out. So what is voiding? Have you ever heard someone say the amount someone is voiding? It's urination. So if you hadn't read that yet in your book, that's a quick give me one for you. So how do the kidneys produce urine? Blood enters the kidneys through the right and left renal arteries. The arterioles carry the blood to the capillaries. I can't even speak today, sorry. Glomeruli filter the blood. So hopefully that helps. And this is a picture of that. It's hard to describe in words, but when you can see the picture, it suddenly makes sense because it's just like everything else. It comes in through the artery, and then it has an exchange in very, very tiny cells, and then you've got the rest of it. So this is a good visual if you were kind of stumped on the last one. And this talks about how the urine is actually produced, how the blood passes through the glomeruli, and then those capsules that surround each glomerulus. Then the renal tubule is attached to each Bowman capsule. And here's a visual. Thankfully, they give us visuals for each of these, because I think if we were stuck with just the slides, it would be a bit challenging. So this shows you, okay, you have your blood, you have the exchange, and it pulls out sugar, water, urea and waste, salts, those hormones that are no longer needed, all those types of things. Those are pulled out, cleaning the blood and leaving it to head off to the next place. So what are the 3 steps in the formation of urine? You have the glomerular filtration, and then you have the tubular reabsorption and tubular secretion. And thankfully, again, they give us another visual for this, so you can see how the filtration occurs, how the reabsorption occurs, and then how the secretion occurs, and then what is excreted from the body through the urine. And isn't it interesting, if you notice, 95% of urine is water. Only 5% of it is waste. The rest of it is water. And so you can see how important it is that on a daily basis we take in a good amount of water. Not too much, but a good amount to help keep us healthy, especially in these hot, hot temperatures of summertime. So you've got the glomerulus and a renal tubule. They combine to form a unit called a nephron. And again, we get a good visual that help us understand how this all works together. So how many nephrons are in a kidney? Ooh, did it tell us on the last page? No, it didn't. You might need to go back to your book for that one or Google it. How do kidneys produce urine? All those collecting tubules lead to the renal pelvis. And then in the renal pelvis, there are these calyxes or calyces, and the term means a cup or case surrounding a flower bud, because that's what they look like. And here's what we see for our visual. So functions of the kidneys. They remove the waste, they balance the water and electrolytes, release hormones, and degrade and eliminate hormones. And you need to remember that, especially if you have anatomy and physiology coming up. This is a really good visual to help you see how from the bloodstream through the renal tubule, I cannot speak today, I'm so sorry, tubule, that process, how reabsorption, filtration, secretion occur. And then from the renal tubule down through the pelvis, the ureter, the bladder, the urethra to the meatus, and then the urine leaves the body. So we are finally to a vocabulary list. We're going to see these nice terms and their meanings and definitions. Pay particular attention to things like calyx or calyx and how those are spelled differently. Make sure that you remember erythropoietin. That is a hormone that's secreted. That is a lot of times used with cancer patients to supplement them when their blood is not forming because they're getting chemo. So you may hear about erythropoietin in other ways in the future if you end up pursuing something in that direction. And we'll probably talk about that a little bit more when we get to the blood system chapter coming up in a few weeks. And I see nitrogenous waste. Um, One thing you may want to look up, just for the fun of it, is a long time ago, urine was used as bleach when doing laundry. Now, they had it sit out in the sun for a couple of weeks before they used it as bleach. But if that's something that you'd like to look up from a historical perspective, that might be of interest to someone. Thankfully, we no longer use that as bleach today. Next week, we'll be talking more about the cardiovascular system. So we'll be talking more about renal veins and veins and arteries, and that we'll get into how arteries carry blood to something and veins carry it away. And again, some more terms for you and their meanings and definitions. Make sure you take note here at the bottom. Urination is also the same as voiding, which is the same as micturition. So make sure that you know all three of those terms and that they're identical. Oh, and really quick, going back here, ureter and urethra. Again, two very different things, spelled differently, but sometimes can be confusing. And now we get to our combining forms. And remember our equation? It's a combining root plus a combining vowel equals the combining form. So combining root plus combining vowel equals combining form. And your combining form may have a prefix, but it will always have a suffix. And here you go. Notice here, there are two combining forms for kidney, nephro and reno. Here are some substances and symptoms. Here are some combining forms and suffixes. So what do we do when we test urine? What are we looking for? We're looking at the color because that tells you something, whether it's very pale or very dark. Appearance, is it thick and kind of sludgy, or is it very thin and pale? What is the pH level? Is it too acidic, too basic? How much protein is in the urine? How much glucose is in the urine? The specific gravity. Are there ketone bodies in there? Is there sediment? Phenylketonuria, bilirubin. So, what does the test of specific gravity reflect? Specific gravity. I'm going to challenge you to look that one up. All right, so we move on to pathologic conditions. What are some things that can happen or go wrong with the kidney? There's glomerulonephritis. I really can't talk, sorry. Glomerulonephritis, interstitial nephritis, nephrolithiasis, and nephrotic syndrome. This is a picture of a kidney with a lot of cysts on it. Do you see all those little bubbles? Those are cysts. All those bubbles. They're not supposed to be there. But polycystic kidney disease is something that unfortunately some people get. With your kidney, you can get pyelonephritis, renal cell carcinoma, renal failure, renal hypertension, and a Wilms tumor. This is an example of renal cell carcinoma on a kidney. See those different cells? They're very, very different than the cells around them. You can have bladder cancer, associated conditions that impact the kidneys. They don't arise in the kidneys, but they impact the kidneys. That's diabetes insipidus and diabetes mellitus. And we'll be talking about those when we get to the endocrine chapter, which is chapter 18, coming up in a couple weeks. So a quiz, term that means frequent urination at night. Which one of these has the beginning, I will say prefix of night? That should help you. And what has the root combining form, or suffix, I should say? What has the suffix that means urine or urination? So what are some lab tests that are done? You will often hear about a BUN. BUN is a common test that is ordered by physicians. Blood, urea, nitrogen. Make sure you memorize that one because that is very important. That one is done very often to check someone's kidneys, how they're progressing, what's going on with those, what's happening. Is there some kind of abnormality? Creatinine clearance tests are also performed to see how well they're processing creatinine. There are all sorts of x-ray studies that are done. CT, urography, kidneys, ureters, and bladder. That is an x-ray. If you hear of a KUB, a doctor orders a KUB, that's kidneys, ureters, and bladder. There's renal angiography, retrograde pyelogram, voiding cystourethrogram. So do they do CTs? Absolutely. This is a scan with contrast that shows a benign cyst on the kidney. Okay. Avoiding cystourethrogram. This shows a female, normal female, the bladder's filled with contrast material, and they x-ray it going through to make sure everything is flowing the way it's supposed to flow. There are other clinical procedures, ultrasonography. Sometimes they're looking at urinary tract structures to see if there's some abnormality or something going on there. Of course, you can do radioisotope scan, imaging of the kidney after injecting that radioisotope into the bloodstream to see how that moves through and if there's any abnormalities identified. MRIs, yes, you can do an MRI, urography, and it's going to show you the bladder, it's going to show you the kidneys, all of that, depending on exactly how you're looking at that. But you're looking at those structures, that process of moving through. So what are some other things that are done? These are more invasive clinical procedures, shall we say. Cystoscopy, dialysis, lithotripsy, renal angioplasty, renal biopsy, renal transplantation, urinary catheterization. A cystoscopy is where you're going to use a cystoscope and take a look all the way up into the bladder. It's no different than any other scope. It's just designed specifically to go up through the penis or vagina, or the urinary meatus. I'm sorry, the urinary meatus to the bladder to visualize that. This happens to be a male that they're showing us, but it's the same concept with a female. Hemodialysis, this is where they pull the blood out and clean it and then put it back in. They filter it, is what it is. It's a super filtration because someone's kidneys can no longer do that for themselves. So because of that, it's done by a machine. Continuous ambulatory peritoneal dialysis. This is where you're putting the solution in and then you're draining it back out. I mean, it really is just what you're seeing. It's doing that to cleanse and filter and purify. It's not a common procedure at all. So abbreviations, what have we got? Lots and lots of abbreviations. CKD is a very common one. We already talked about BUN, but CKD is very. ARF, be very careful with ARF because some people use it for acute respiratory failure and other people use it for acute renal failure. And ARF in the wrong context can lead to medical errors. So be very careful with that. AKI, acute renal injury or acute kidney injury, that is a lot more common as well. So again, CKD and B1, very common. Watch out for ARF. Let's give you some more. IVPs are often performed, the intravenous pyelograms. KUB we talked about. K plus is potassium, Na plus is sodium. For those of you who have taken chemistry, you know this already. For those of you who have not taken chemistry, this gives you a little bit of a leg up to know those. pH is potential hydrogen. Did you know that? That's what the pH stands for, potential hydrogen. It's the degree of acidity or alkalinity. Alkaline or base is opposite of acid. UA for urinalysis, that's a very common one. UTI, another very common one. So those are ones you want to know. Abbreviation RP is associated with which of the following? I think we just had that, didn't we? Did we just have RP? We'll run back for a minute and see. Did we have RP? Retrograde pyelogram. Okay, retrograde pyelogram. Now let's go back. Now that you know where to look for it. Retrograde pyelogram. Does that sound like fluid injected into the peritoneal cavity and then drained out? No. Does it sound like contrast that's injected into urinary bladder and ureters and x-rays are taken of the urinary tract? Maybe. Retrograde pyelogram. Does it sound like nitrogenous wastes are removed from the patient's blood? Nope. An electrolyte is secreted by renal tubules. Well, if you think about it, retrograde pyelogram. Gram is a record. It's a recording of a test. Retrograde often has the connotation of contrast. Does that help? I think you can get this one. So let's talk about the combining forms again. We've got more of them here. Watch out for the ones that are spelled differently. ISCH/O. Ish. ISCH. So make sure you work on that one to hold back or back. And still we have more. And here we get into ectasis, ectomy, otomy, some of these other ones. Make sure that you know the difference between ectasis, which is stretching or dilation, versus ectomy, which is a complete removal or excision, versus otomy, which is an incision into or making an entry into. Make sure you know how to spell lithiasis. Lithiasis, lithiasis. And that is stones. Anytime you say lithy, think stones. Some of these you've had before and some are a little bit different. Notice the difference between otomy and tomy. They're very, very similar. Notice anti. It's not just against, but it can be an again. Oops, ran past that one. Combining form, dipso. What does it mean? Dipso. And let you figure that one out. Combining form that means pus. Isho. It's a good thing that I it's a good thing I pointed this one out to you a few slides back, so you've got it. All right, that's it. It's a miracle. We made it through 100 slides in less than 30 minutes. I'm hoping that you're doing all right, staying cool in this heat, and hanging in there. So I will be back with Chapter 8 next, and we'll see how it goes.